Question 1. Which approach would be most appropriate for a certified occupational therapy assistant COTA to utilize when developing an intervention plan for a client who has expressed a desire to return to gardening but is experiencing significant fatigue and decreased fine motor coordination following a stroke? Option A. Immediately implement a structured fine motor exercise program that the therapist believes will be most effective for improving coordination, with the expectation that the client will eventually be able to garden. Option B. Collaboratively develop SMART goals with the client and family that address fatigue management and fine motor skill improvement. Analyze the client's current gardening activities and adapt them to promote participation while establishing a plan for gradual restoration of skills. Option C. Focus solely on the client's stated desire to garden by providing adaptive gardening tools without assessing their current functional abilities or setting measurable goals for skill development. Option D. Prioritize a high-intensity endurance program to combat fatigue, deferring any specific fine motor interventions until the client's stamina has significantly improved. Correct answer is B. Collaboratively develop SMART goals with the client and family that address fatigue management and fine motor skill improvement. Analyze the client's current gardening activities and adapt them to promote participation while establishing a plan for gradual restoration of skills. Explanation. Scenario analysis. This scenario presents a common challenge in occupational therapy practice, where a client's immediate needs and preferences may conflict with the therapist's professional judgment regarding the most effective long-term intervention. The COTA must balance client autonomy and the therapeutic relationship with the ethical and regulatory obligation to provide evidence-based and goal-oriented care. The challenge lies in ensuring the intervention plan is client-centered while also being structured to achieve measurable outcomes, adhering to the principles of SMART goal setting and appropriate intervention approaches as outlined by the regulatory framework for COTA. Correct approach analysis. The approach that prioritizes developing a collaborative plan with the client and family, focusing on establishing SMART goals that address the client's stated priorities and functional limitations, and then selecting intervention strategies that align with these goals and the client's capabilities, represents best professional practice. This aligns with the COTA role in implementing interventions under the supervision of an occupational therapist and adhering to the principles of client-centered practice. The regulatory framework for COTA emphasizes the importance of client participation in goal setting and intervention planning, ensuring that interventions are meaningful and relevant to the individual. The use of SMART goals, specific, measurable, achievable, relevant, time-bound, is a cornerstone of effective intervention planning, providing a clear roadmap for progress and evaluation. Selecting intervention strategies that are appropriate for the client's current abilities and the desired outcomes, and adapting activities as needed, directly supports the establishment or restoration of function, or the modification of tasks to promote participation. Incorrect approaches analysis. An approach that solely focuses on the therapist's preferred intervention without significant client input risks violating the principle of client-centered practice, which is a fundamental ethical and regulatory expectation. This can lead to decreased client engagement and adherence. An approach that neglects to establish measurable goals or sets goals that are not relevant to the client's functional limitations or stated priorities fails to meet the requirements of effective intervention planning and can lead to an inefficient use of therapeutic resources. This also undermines the ability to demonstrate progress and justify continued services. An approach that prioritizes a single intervention strategy without considering alternative approaches or adapting activities based on the client's response or environmental factors may not be the most effective or client-centered. This can overlook opportunities to optimize outcomes or address emerging needs. Professional reasoning. Professionals should engage in a collaborative process with the client and their family, actively listening to their concerns and priorities. This forms the foundation for client-centered practice. The COTA, in conjunction with the occupational therapist, should then translate these priorities into SMART goals that are specific, measurable, achievable, relevant, and time-bound. The selection of intervention strategies should be based on evidence-based practice, the client's current abilities, and the established goals. Activity analysis and adaptation are crucial tools to ensure that the chosen occupations and activities are therapeutic and promote the desired outcomes. Regular evaluation of progress towards goals and ongoing communication with the client and family are essential for adjusting the intervention plan as needed. Question 2. The analysis reveals that a certified occupational therapy assistant COTA is documenting a progress note for a client who has been working on improving their ability to prepare simple meals. During the session, the client successfully followed a recipe to make toast and a sandwich, but expressed frustration when the bread slices were unevenly cut. The COTA is considering how to best document this interaction, balancing the client's success with their expressed emotion. Which of the following documentation approaches best adheres to professional standards and regulatory requirements? Option A. Document that the client was generally able to prepare a sandwich and toast, but was easily frustrated by minor imperfections. Option B. Document the client's successful meal preparation, but omit any mention of the client's frustration to maintain a positive tone. Option C. Document the client's successful completion of the recipe for toast and a sandwich, noting the client's verbalization of frustration regarding the unevenly cut bread, and describing the observable behavior associated with this frustration, e.g., sighing, furrowed brow. Option D. Document the client's frustration as a sign of their overall poor mood and inability to cope with challenges, and suggest a psychological referral. The correct answer is C. Document the client's successful completion of the recipe for toast and a sandwich, noting the client's verbalization of frustration regarding the unevenly cut bread, and describing the observable behavior associated with this frustration, e.g., sighing, furrowed brow. Explanation. This scenario presents a professionally challenging situation because it requires the certified occupational therapy assistant, COTA, to balance the immediate need for accurate documentation with the potential for bias or subjective interpretation that could impact the client's care plan and reimbursement. The COTA must ensure their documentation is objective, factual, and directly reflects the client's performance and participation in therapy, adhering strictly to the principles of professional documentation and regulatory requirements. The correct approach involves documenting observable behaviors and objective findings related to the client's occupational performance. This aligns with the principles of good documentation, which emphasize accuracy, completeness, and objectivity. Specifically, it adheres to HIPAA regulations by ensuring that documentation is relevant to the client's care and is maintained confidentially. Furthermore, for reimbursement purposes, documentation must clearly demonstrate the skilled services provided by the COTA and the client's progress towards established goals, justifying the need for continued therapy. This approach ensures that the documentation is defensible, ethical, and compliant with all applicable regulations. An incorrect approach would be to include subjective opinions or interpretations of the client's emotional state without direct observable evidence. This violates the principle of objectivity in documentation and could lead to misinterpretations of the client's needs, potentially impacting the treatment plan and reimbursement. Such documentation may not meet the standards required by payers and could be seen as a breach of professional conduct. Another incorrect approach would be to omit details about the client's participation or performance in specific activities, focusing only on general statements. This lack of specificity makes it difficult to assess progress, justify the need for services, and could lead to issues with reimbursement. It also fails to provide a clear picture of the client's functional status, which is crucial for continuity of care. A further incorrect approach would be to document information that is not directly observed or relevant to the occupational therapy intervention. This could include personal opinions about the client's family or unrelated medical history. Such extraneous information is a violation of confidentiality and HIPAA regulations, as it is not necessary for the provision of occupational therapy services and can compromise the client's privacy. Professional reasoning process for similar situations involves a systematic approach. First, identify the core ethical and regulatory requirements, e.g., HIPAA documentation principles. Second, gather objective data related to the client's occupational performance. Third, document this data factually and concisely, focusing on observable behaviors and measurable outcomes. Fourth, review the documentation to ensure it is accurate, complete, relevant, and free from bias. Finally, consider how the documentation supports the client's goals and justifies the skilled services provided for reimbursement. Question 3. Quality control measures reveal that a certified occupational therapy assistant, COTA, is consistently documenting client evaluations that lack a cohesive integration of information. Specifically, the COTA often relies heavily on the medical chart, without conducting thorough client interviews or direct observation of functional tasks. In other instances, the COTA administers numerous standardized assessments without a clear rationale linked to the client's reported difficulties or chart review findings. Which approach best reflects the COTA responsibility in the screening and evaluation process according to current occupational therapy practice standards? Option A. Primarily rely on the detailed medical chart to understand the client's history and diagnosis, assuming this information is sufficient for developing an intervention plan without extensive direct client interaction. Option B. Focus on the client's subjective reports during the interview, using this information as the primary basis for assessment and intervention planning, with minimal reliance on objective measures or chart review. Option C. Systematically integrate information from the chart review with targeted client interviews, direct observation of occupational performance, and the judicious selection of standardized and non-standardized assessments that are relevant to the client's identified needs and goals. Option D. Administer a broad range of standardized assessments to gather as much data as possible, regardless of their direct relevance to the client's presenting problems, to ensure a comprehensive overview. The correct answer is C. Systematically integrate information from the chart review with targeted client interviews, direct observation of occupational performance, and the judicious selection of standardized and non-standardized assessments that are relevant to the client's identified needs and goals. Explanation. Scenario analysis. This scenario presents a common challenge in occupational therapy practice, where a COTA must interpret and apply information from various sources to accurately assess a client's needs. The challenge lies in synthesizing fragmented data from a chart review with direct observation and interview findings to form a comprehensive understanding of the client's occupational performance. The COTA must ensure their assessment is client-centered, evidence-based, and adheres to professional standards of practice, particularly regarding the selection and administration of appropriate assessment tools. Correct approach analysis. The correct approach involves a systematic process of integrating information from the chart review with direct client interaction. This begins with a thorough review of the medical chart to understand the client's history, diagnosis, and previous interventions. This foundational knowledge then informs the COTA approach to the interview, allowing for targeted questions that explore the client's current occupational roles, challenges, and goals. Direct observation of the client's performance in relevant contexts, coupled with the administration of appropriate standardized and non-standardized assessments, provides objective and subjective data. The COTA ability to synthesize these diverse data points, interpret the results in relation to the client's occupational performance and client factors, and then select appropriate assessments based on the initial findings is crucial. This aligns with the COTA Occupational Therapy Practice Framework, Domain and Process, 4th ed., which emphasizes the importance of evaluation, including occupational profile, analysis of occupational performance, and the use of assessments to inform intervention planning. Ethical considerations, such as client autonomy and beneficence, also guide this comprehensive approach, ensuring interventions are tailored to the individual's unique needs and goals. Incorrect approaches analysis. One incorrect approach would be to solely rely on the chart review without engaging the client directly. This fails to capture the client's subjective experience, current functional status, and personal goals, leading to an incomplete and potentially inaccurate assessment. It neglects the client-centered nature of occupational therapy and may result in interventions that are not meaningful or effective for the individual. Another incorrect approach would be to administer a battery of standardized tests without a clear rationale derived from the chart review or initial client interaction. This can be time-consuming, costly, and may not yield relevant information if the chosen assessments do not align with the client's presenting problems or occupational deficits. It demonstrates a lack of clinical reasoning and may not be the most efficient or effective use of resources. A third incorrect approach would be to prioritize subjective client reports over objective findings from observation or standardized assessments. While client input is vital, a comprehensive evaluation requires a balance of subjective and objective data to ensure a well-rounded understanding of the client's capabilities and limitations. Over-reliance on subjective reports without objective corroboration can lead to biased interpretations and inappropriate intervention planning. Professional reasoning. Professionals should employ a systematic and client-centered approach to evaluation. This involves beginning with a thorough understanding of the client's history and current situation through chart review, followed by direct engagement with the client through interviews and observation. The selection of assessment tools should be guided by the information gathered and the specific occupational performance deficits identified. The process should be iterative, with findings from one step informing the next, leading to a comprehensive and accurate interpretation of results that guides effective intervention planning. Adherence to the COTA practice framework and ethical principles ensures that the evaluation process is both effective and client-focused. Question 4. Risk assessment procedures indicate a need to evaluate the foundational understanding of occupational therapy principles in a new COTA. Considering the historical evolution of the profession and its philosophical base, which of the following approaches best reflects the core belief that occupation is both a means to achieve therapeutic outcomes and an end in itself, promoting client participation in meaningful life activities? Option A. Prioritizing the use of structured, repetitive activities designed to improve specific motor skills, with the primary goal being the restoration of physical function. Option B. Emphasizing client-centered engagement in activities that are personally meaningful and valued by the individual, recognizing that the act of participation itself contributes to well-being and is a therapeutic goal. Option C. Utilizing therapeutic exercises prescribed by a physician to address specific deficits, viewing occupation solely as a modality for treatment. Option D. Focusing on the historical contributions of early pioneers like Eleanor Clark Slagle, without fully integrating their ideas into current practice frameworks. The correct answer is A. Prioritizing the use of structured, repetitive activities designed to improve specific motor skills, with the primary goal being the restoration of physical function. Explanation. This scenario presents a professional challenge because it requires the Certified Occupational Therapy Assistant, COTA, to navigate the historical philosophical underpinnings of occupational therapy while applying them to a contemporary client situation. The core difficulty lies in discerning which historical perspective most accurately reflects the profession's foundational belief in occupation as both a means to an end and an end in itself, and how this translates into therapeutic action. Careful judgment is required to avoid misinterpreting historical influences or applying outdated philosophies that do not align with current ethical and regulatory standards for occupational therapy practice. The correct approach involves recognizing that the philosophical base of occupational therapy, emphasizing occupation as both a means and an end, is a cornerstone that has evolved but remains central. This perspective suggests that engaging in meaningful activities occupation is not only a tool to achieve a specific therapeutic outcome, means, but also the ultimate goal of therapy itself, end. This aligns with the core values of occupational therapy, such as client-centeredness and promoting participation in meaningful life roles. The COTA role is to facilitate this engagement, drawing on the client's interests and values to promote well-being and independence. This approach is ethically justified by the profession's commitment to client autonomy and the pursuit of meaningful lives, as reflected in the philosophical underpinnings and core values. An incorrect approach would be to solely focus on early mechanistic or purely biomedical models of rehabilitation that viewed occupation as merely a passive exercise for physical restoration, without acknowledging its inherent value and meaning to the individual. This fails to embrace the holistic and client-centered philosophy that defines modern occupational therapy. Such an approach would be ethically problematic, as it neglects the client's subjective experience and the importance of personal meaning in recovery, potentially leading to interventions that are not truly occupation-based or client-centered. Another incorrect approach would be to prioritize the means aspect of occupation to the exclusion of the end aspect. This might involve using activities solely as a means to improve a specific deficit, without considering whether the activity itself is meaningful or desired by the client as an end goal. This overlooks the fundamental principle that occupation is intrinsically motivating, and that the ultimate aim is for clients to engage in occupations they value for their own sake. Ethically, this approach risks devaluing the client's personal goals and preferences, leading to interventions that are less effective and potentially disempowering. A further incorrect approach would be to rely on a purely historical anecdote or a single key figure's contribution, without understanding how that contribution fits into the broader evolution of the profession's philosophy. While historical figures are important, The profession's philosophical base is a synthesis of many influences and has evolved over time. Focusing too narrowly on one aspect risks misinterpreting the current philosophical stance. This is ethically unsound, as it can lead to an incomplete or inaccurate understanding of professional responsibilities and the rationale behind therapeutic interventions. The professional decision-making process for similar situations should involve a thorough understanding of the historical evolution of occupational therapy's philosophical base, including the contributions of key figures and the development of core values. The COTA should then critically analyze how these foundational principles apply to the current client's needs and goals, always prioritizing a client-centered approach that views occupation as both a therapeutic tool and a meaningful end in itself. This involves actively listening to the client, identifying their valued occupations, and collaboratively developing interventions that promote participation and well-being. Question 5. The audit findings indicate that the documentation for a client's meal preparation IETL intervention lacks detail regarding the specific adaptive equipment used and the client's observed performance with it. The COTA is reviewing their notes to determine the most appropriate next step. Which of the following actions best addresses the audit findings and upholds professional standards? Option A. Add a general statement to the client's record indicating that adaptive equipment was used for meal preparation, without specifying the equipment or performance details. Option B. Consult with a supervisor to discuss the audit findings and request guidance on how to retroactively adjust the documentation without re-evaluating the client. Option C. Schedule a follow-up session to reassess the client's meal preparation skills without focusing on the previous documentation gap. Option D. Update the client's record to include a detailed description of the adaptive equipment utilized, the client's specific performance with the equipment during the session, and the rationale for its selection, along with any observed challenges or successes. The correct answer is D. Update the client's record to include a detailed description of the adaptive equipment utilized, the client's specific performance with the equipment during the session, and the rationale for its selection, along with any observed challenges or successes. Explanation. The audit findings indicate a need to review the COTA documentation and intervention strategies related to instrumental activities of daily living, IETL. This scenario is professionally challenging because it requires the COTA to critically evaluate their own practice against established regulatory standards and ethical principles, specifically concerning the assessment and intervention for IETL. The complexity lies in ensuring that interventions are not only effective, but also client-centered, safe, and documented in a manner that meets legal and professional requirements. Careful judgment is required to identify areas for improvement and to implement changes that enhance client outcomes and maintain compliance. The correct approach involves a thorough review of the client's current IETL performance, the rationale behind the chosen interventions, and the documentation supporting these decisions. This includes verifying that assessments were comprehensive, interventions were tailored to the client's specific needs and goals, adaptive equipment and techniques were appropriately selected and implemented, safety considerations were addressed, and caregiver training was provided and documented. Regulatory frameworks for COTA, such as those established by the American Occupational Therapy Association, AOTA, and state licensing boards, mandate that services be evidence-based, client-centered, and delivered with competence and integrity. Ethical principles, particularly those related to beneficence and non-maleficence, require the COTA to act in the best interest of the client and to avoid harm. Documentation must accurately reflect the services provided and the client's progress, serving as a legal record and a communication tool. An incorrect approach would be to dismiss the audit findings without a thorough self-assessment, assuming current practices are adequate. This fails to acknowledge the potential for improvement and the responsibility to adhere to evolving professional standards and regulatory requirements. Another incorrect approach is to focus solely on the technical aspects of IETL intervention, without considering the client's psychosocial context, preferences, or the environmental factors that influence their ability to perform these activities. This overlooks the holistic nature of occupational therapy and the importance of client engagement. Furthermore, neglecting to document the rationale for interventions, the client's response, and any modifications made is a significant regulatory and ethical failure, as it compromises accountability, continuity of care, and legal defensibility. The professional decision-making process for similar situations should involve a systematic review of the audit findings, a self-reflection on current practices, and a comparison against relevant regulatory guidelines and ethical codes. This should be followed by a plan for professional development or practice modification, if necessary, and clear, accurate documentation of all interventions and client progress. Question 6. Process analysis reveals a certified occupational therapy assistant, COTA, is working with a client who has recently experienced a stroke resulting in mild hemiparesis and decreased balance. The client expresses a strong desire to participate in a community gardening club, an activity they previously enjoyed. However, the COTA observes that the client struggles with gripping small tools and maintaining stable posture for extended periods. The COTA is unsure how to best support the client's goal while ensuring their safety and maximizing their potential for successful engagement. Which of the following approaches best reflects the COTA role and responsibilities within the occupational therapy process as guided by the OT4? Option A. Proceed with assisting the client in gardening activities as requested, without consulting the supervising occupational therapist, assuming the client's motivation will overcome any physical barriers. Option B. Immediately facilitate the client's participation in the gardening club by providing adaptive tools and encouraging them to try, as their desire is paramount. Option C. Advise the client that gardening is likely too challenging given their current physical limitations and suggest they focus on less demanding activities. Option D. Collaborate with the supervising occupational therapist to conduct a further evaluation of the client's current motor skills and balance, and jointly develop an intervention plan that may include preparatory activities, task modifications, or environmental adaptations to support participation in gardening. The correct answer is B. Immediately facilitate the client's participation in the gardening club by providing adaptive tools and encouraging them to try, as their desire is paramount. Explanation. Scenario analysis. This scenario presents a professional challenge because the COTA must balance the client's expressed desires with the therapist's professional judgment regarding the client's safety and ability to engage in meaningful occupation. The COTA must consider the client's current performance skills and client factors within the context of their environment to determine appropriate interventions. The challenge lies in advocating for the client's autonomy while ensuring interventions are safe, effective, and aligned with the occupational therapy process as defined by the Occupational Therapy Practice Framework. Domain and process. OT4. Correct approach analysis. The correct approach involves the COTA collaborating with the supervising occupational therapist OT to reevaluate the client's current performance skills and client factors. This aligns with the OT4 emphasis on the evaluation process, specifically the analysis of occupational performance. By reassessing the client's motor skills, process skills, and relevant client factors, e.g., body functions like balance and coordination, the COTA and OT can determine if the client's current abilities support safe participation in the desired occupation. This collaborative reevaluation allows for the development of an updated intervention plan that addresses any identified deficits, potentially through preparatory methods or modifying the task or context, thereby ensuring client safety and promoting successful occupational engagement. This adheres to the ethical principle of beneficence and non-maleficence by prioritizing the client's well-being and avoiding harm. Incorrect approaches analysis. One incorrect approach involves the COTA immediately agreeing to facilitate the client's request without further assessment. This fails to uphold the COTA responsibility to analyze occupational performance and ensure safety. It bypasses the crucial evaluation and intervention planning stages outlined in the OT4, potentially leading to an unsafe situation for the client and compromising the integrity of the occupational therapy process. This approach neglects the professional obligation to consider client factors and performance skills that may impede safe participation. Another incorrect approach is for the COTA to dismiss the client's desire as unrealistic without attempting to understand the underlying motivation or exploring potential modifications. This approach disregards the client's role in goal setting and their subjective experience of occupation, which are central to the OT4 domain of client values, beliefs, and spirituality. It also fails to explore the intervention process, which includes adapting tasks and contexts to facilitate participation. A third incorrect approach is for the COTA to proceed with the activity without informing the supervising OT. This violates the COTA scope of practice and the collaborative nature of occupational therapy. The COTA is responsible for implementing interventions under the supervision of an OT, and significant changes or safety concerns require OT input and oversight. This failure to communicate and collaborate undermines the professional relationship and the client's care plan. Professional reasoning. Professionals should approach such situations by first acknowledging the client's expressed desire and exploring their motivation. Then, they should consult the OT4 to guide their assessment of the client's current performance skills, client factors, and the demands of the occupation within its context. If there are concerns about safety or the client's ability to perform the occupation successfully, the COTA should collaborate with the supervising OT to conduct a thorough reevaluation and adjust the intervention plan accordingly. This may involve breaking down the occupation into smaller steps, providing adaptive equipment, modifying the environment, or implementing preparatory activities to improve the client's skills. The decision-making process should always prioritize client safety, promote meaningful engagement, and adhere to the established occupational therapy process and ethical guidelines. Question 7. Consider a scenario where a certified occupational therapy assistant, COTA, is working with a client who has recently experienced a moderate ischemic stroke, resulting in left-sided hemiparesis, mild visual field deficits, and some challenges with executive functions such as planning and sequencing. The client is motivated but experiences fatigue easily. The COTA has received a referral to implement interventions to improve functional mobility and retraining for activities of daily living adult. Which of the following approaches best reflects the COTA role and responsibilities in this situation, adhering to the principles of occupational therapy practice for neurological conditions? Option A. Independently develop and implement a specialized dysphagia management program, including swallowing exercises and diet modifications, based on the COTA general knowledge of neurological conditions, without specific delegation or supervision from a speech-language pathologist or occupational therapist. Option B. Focus exclusively on gross motor activities for functional mobility, such as transfers and gait training. Delegate all ADL retraining to family members, as the COTA primary role is to address gross motor skills. Option C. Conduct a comprehensive assessment of the client's motor control, sensory integration, visual perception, and cognitive abilities, and then implement a treatment plan that integrates NDT principles for motor relearning, strategies for visual scanning, cognitive exercises to improve sequencing, and adaptive techniques for ADLs, while monitoring for fatigue and adjusting activity levels accordingly. Option D. Immediately initiate constraint-induced movement therapy, CIMT, for the affected upper extremity, focusing solely on repetitive task-specific training to maximize motor recovery, without a thorough initial assessment of other functional deficits or cognitive status. Correct answer is C. Conduct a comprehensive assessment of the client's motor control, sensory integration, visual perception, and cognitive abilities, and then implement a treatment plan that integrates NDT principles for motor relearning, strategies for visual scanning, cognitive exercises to improve sequencing, and adaptive techniques for ADLs, while monitoring for fatigue and adjusting activity levels accordingly. Explanation. This scenario presents a professional challenge due to the complexity of managing a client with a recent stroke and the need to integrate multiple therapeutic approaches while adhering to established COTA scope of practice and ethical guidelines. The client's fluctuating cognitive status and motor deficits require careful observation, ongoing assessment, and a dynamic treatment plan. The COTA must balance the application of evidence-based interventions with the client's immediate functional needs and safety. The correct approach involves a systematic and client-centered strategy that prioritizes safety and functional independence within the COTA scope of practice. This includes conducting a thorough assessment of the client's current functional abilities, identifying specific deficits impacting their activities of daily living, adult, and developing an intervention plan that incorporates principles of neurodevelopmental treatment, NDT, for motor control and sensory integration, alongside strategies for cognitive rehabilitation and visual perception. The COTA would then implement interventions focused on improving functional mobility and ADL retraining, utilizing adaptive equipment as necessary. This approach is justified by the COTA role in implementing established treatment plans under the supervision of an occupational therapist, focusing on measurable functional outcomes, and adhering to the ethical principles of beneficence and non-maleficence by providing safe and effective care. The emphasis on a comprehensive assessment and individualized intervention plan aligns with regulatory requirements for competent practice. An incorrect approach would be to solely focus on one therapeutic modality, such as only implementing constraint-induced movement therapy, CIMT, without a comprehensive assessment of the client's overall functional status, cognitive abilities, or sensory processing. This would be a regulatory and ethical failure because it neglects the multifaceted nature of stroke recovery and may not address all of the client's needs, potentially leading to suboptimal outcomes or even harm if the client is not ready for such an intensive intervention. Another incorrect approach would be to independently initiate advanced dysphagia interventions without explicit delegation and supervision from the occupational therapist or a speech-language pathologist, as this exceeds the COTA scope of practice and could pose a significant safety risk to the client. Furthermore, neglecting to document progress and adapt the treatment plan based on the client's response would be a failure to meet professional documentation standards and could impede effective communication within the healthcare team. Professional decision-making in such situations requires a systematic process. First, thoroughly understand the client's diagnosis and its implications for function. Second, conduct a comprehensive occupational therapy assessment to identify specific deficits and strengths. Third, collaborate with the supervising occupational therapist to develop a client-centered, evidence-based intervention plan that aligns with the COTA scope of practice. Fourth, implement interventions with fidelity, continuously monitor the client's response, and document progress accurately. Finally, communicate effectively with the healthcare team and adapt the plan as needed to ensure optimal client outcomes and safety. Question 8. The assessment process reveals that a client with a recent stroke has expressed a strong desire to participate in a specific type of gardening activity that was not initially included in their occupational therapy plan. The client believes this activity will be highly motivating and beneficial for their recovery, but the COTA has concerns about the client's current balance and endurance for the proposed activity. What is the most appropriate course of action for the COTA? Option A. Attempt to lead the client through the gardening activity independently, focusing on the client's expressed desire without consulting the occupational therapist. Option B. Proceed with the client's preferred gardening activity as requested, assuming the client's motivation will overcome any potential safety risks. Option C. Collaborate with the occupational therapist to explore modifications and adaptations to the gardening activity that would align with the client's goals and ensure safety, and then implement the modified activity under supervision. Option D. Inform the client that their preferred activity cannot be incorporated into the plan, and insist on proceeding with the originally scheduled therapeutic exercises. The correct answer is C. Collaborate with the occupational therapist to explore modifications and adaptations to the gardening activity that would align with the client's goals and ensure safety, and then implement the modified activity under supervision. Explanation: this scenario is professionally challenging because it requires the Certified Occupational Therapy Assistant, COTA, to balance the client's immediate needs and preferences with the therapist's professional judgment regarding safety and efficacy of interventions. The COTA must consider the client's right to self-determination while also upholding their responsibility to provide skilled care within their scope of practice and under the supervision of an occupational therapist. Careful judgment is required to ensure interventions are appropriate, safe, and aligned with the established plan of care. The correct approach involves the COTA collaborating with the occupational therapist to address the client's expressed desire for a specific activity. This approach is correct because it upholds the ethical principle of client-centered care by acknowledging and respecting the client's preferences. Simultaneously, it adheres to regulatory requirements by ensuring that any modification or adaptation of the intervention plan is reviewed and approved by the supervising occupational therapist, who is responsible for the overall treatment plan and its appropriateness. This collaborative process ensures that the client's goals are met in a safe and effective manner within the COTA scope of practice. An incorrect approach would be for the COTA to unilaterally decide to proceed with the client's preferred activity without consulting the occupational therapist. This is ethically problematic as it bypasses the supervisory relationship and the occupational therapist's responsibility for treatment planning. could lead to an intervention that is not aligned with the client's overall goals, is unsafe, or is outside the COTA competency. Another incorrect approach would be to dismiss the client's preference entirely and insist on the originally planned activity without exploring potential modifications or compromises. This fails to respect the client's autonomy and can negatively impact engagement and motivation. Finally, attempting to implement a complex or advanced therapeutic technique that is beyond the COTA training or scope of practice, even if requested by the client, would be a significant regulatory and ethical failure, potentially leading to harm. Professionals should use a decision-making framework that prioritizes client safety and well-being, respects client autonomy, adheres to the established plan of care, and maintains clear communication and collaboration with the supervising occupational therapist. When faced with a discrepancy between client preference and the planned intervention, the professional reasoning process should involve 1. Active listening to understand the client's rationale and goals. 2. Assessing the feasibility and safety of the client's request within the context of the treatment plan. 3. Consulting with the supervising occupational therapist to discuss the client's preference and explore potential adaptations or alternative interventions. 4. Documenting the discussion and the agreed-upon course of action. Question 9. System analysis indicates a certified occupational therapy assistant, COTA, is working with a client who has expressed a strong desire to modify a therapeutic activity in a way that the COTA believes may compromise the safety and effectiveness of the intervention. The COTA has observed potential risks associated with the client's proposed modification. What is the most ethically and professionally sound approach for the COTA to take in this situation? Option A. Inform the client that their request cannot be accommodated and continue with the original intervention without further discussion. Option B. Engage in a collaborative discussion with the supervising occupational therapist, OTR, and the client to explore the client's request, the COTA concerns, and potential alternative solutions that balance client autonomy with safety and efficacy. Option C. Proceed with implementing the client's requested modification, as the client has the right to direct their own therapy. Option D. Immediately refuse to implement the client's requested modification, explaining that it is unsafe and not within the scope of the current treatment plan. The correct answer is B. Engage in a collaborative discussion with the supervising occupational therapist, OTR, and the client to explore the client's request, the COTA concerns, and potential alternative solutions that balance client autonomy with safety and efficacy. Explanation. Scenario analysis. This scenario presents a professional challenge due to the inherent conflict between a client's expressed wishes and the COTA professional judgment regarding safety and efficacy. The COTA must navigate the ethical principles of autonomy, respecting the client's right to make decisions, and beneficence/non-maleficence, acting in the client's best interest and avoiding harm. The potential for a negative outcome if the client's wishes are followed without careful consideration, or conversely, the risk of alienating the client and undermining the therapeutic relationship if their autonomy is disregarded, makes this situation ethically complex. Correct approach analysis. The correct approach involves a collaborative discussion with the supervising occupational therapist, OTR, and the client. This aligns with the COTA scope of practice, which mandates supervision by an OTR for evaluation, intervention planning, and reevaluation. The COTA responsibility includes communicating observations and client concerns to the OTR. By engaging in this dialogue, the COTA upholds the principle of beneficence by seeking expert guidance to ensure the intervention remains safe and effective. Simultaneously, by involving the client in the discussion, the COTA respects their autonomy and promotes shared decision-making, fostering fidelity to the client. This approach adheres to the ethical principle of justice by ensuring the client receives appropriate and equitable care. Incorrect approaches analysis. One incorrect approach is to unilaterally refuse to implement the client's requested modification. This disregards the client's autonomy and may be perceived as paternalistic, potentially damaging the therapeutic alliance and violating the principle of fidelity. It also bypasses the necessary collaborative process with the OTR, exceeding the COTA independent decision-making authority in such complex situations. Another incorrect approach is to immediately implement the client's requested modification without consulting the OTR or thoroughly discussing the potential risks with the client. This fails to uphold the principles of beneficence and non-maleficence by potentially exposing the client to harm or ineffective treatment. It also violates the COTA professional responsibility to practice under OTR supervision and to communicate critical client information. A third incorrect approach is to ignore the client's request and continue with the original plan without any discussion. This demonstrates a lack of respect for the client's autonomy and can lead to client dissatisfaction and non-adherence. It also fails to address a potential issue that might impact the effectiveness of the intervention, thus not fully acting in the client's best interest. Professional reasoning. Professionals facing similar situations should employ a systematic ethical decision-making process. This typically involves 1. Identifying the ethical issue and relevant ethical principles. 2. Gathering all relevant facts, including client preferences, clinical observations, and supervisory input. 3. Identifying potential courses of action. 4. Evaluating the potential consequences of each action in relation to ethical principles and professional standards. 5. Selecting the most ethically justifiable course of action, which often involves collaboration and communication. 6. Implementing the chosen action and reflecting on the outcome. In this case, the COTA role is to facilitate communication and bring potential ethical concerns to the OTR for collaborative problem solving, always keeping the client's well-being and autonomy at the forefront. Question 10. The control framework reveals that a COTA is implementing a cognitive rehabilitation program for a client with TBI who struggles with attention and memory. The COTA has identified that the client benefits from structured routines and visual cues. The supervising OT has established a plan of care that includes both remediation and compensatory strategies. Which of the following approaches best reflects the COTA role in implementing this plan while addressing the client's specific needs and adhering to regulatory guidelines? Option A. The COTA focuses exclusively on teaching the client to use external memory aids like a smartphone app, without addressing the underlying attention and memory deficits or involving the family. Option B. The COTA suggests to the supervising OT that the client's cognitive deficits are too severe for rehabilitation and recommends discontinuing services. Option C. The COTA independently develops a new set of memory games and attention-building exercises based on their own clinical experience, bypassing the OT's established plan. Option D. The COTA collaborates with the supervising OT to select and implement specific task modifications and environmental supports, such as visual schedules and simplified instructions, while also incorporating attention and memory exercises as outlined in the OT's plan, and provides education to the client's family on how to reinforce these strategies at home. The correct answer is C. The COTA independently develops a new set of memory games and attention-building exercises based on their own clinical experience, bypassing the OT's established plan. Explanation. The control framework reveals that a certified occupational therapy assistant, COTA, is tasked with implementing a cognitive rehabilitation program for a client with moderate traumatic brain injury, TBI, experiencing significant deficits in attention and memory. The professional challenge lies in balancing the client's immediate needs for functional independence with the long-term goals of cognitive restoration and generalization of skills, all while adhering to the ethical and regulatory standards governing COTA practice within the United States. This requires a nuanced understanding of evidence-based interventions and the scope of practice for COTA. The correct approach involves the COTA collaborating with the supervising occupational therapist, OT, to select and implement evidence-based cognitive rehabilitation strategies tailored to the client's specific deficits and goals. This includes utilizing task modification and environmental modifications to support immediate functional performance while simultaneously incorporating strategies that promote attention and memory skill development. Caregiver training is also crucial for ensuring carryover of learned skills into the client's daily life and community. This approach aligns with the COTA Occupational Therapy Practice Framework, OTF, which emphasizes client-centered care, occupation-based interventions, and the COTA role in implementing the OT's established plan of care. Specifically, the OT's role in assessment and intervention planning, and the COTA role in implementing that plan, are critical. Ethical considerations, such as beneficence and non-maleficence, necessitate interventions that are both effective and safe, promoting the client's well-being and preventing harm. An incorrect approach would be for the COTA to independently design and implement a new cognitive rehabilitation program without the direct supervision and established plan of care from the supervising OT. This violates the regulatory framework that defines the COTA role as implementing interventions under the direction of an OT. It also poses an ethical risk by potentially providing interventions that are not evidence-based or appropriate for the client's specific needs, thereby failing to act in the client's best interest. Another incorrect approach would be to solely focus on compensatory strategies and environmental modifications without incorporating active cognitive rehabilitation techniques aimed at improving underlying cognitive skills. While compensatory strategies are valuable, a comprehensive program should also aim to remediate or improve cognitive functions where possible, as guided by the OT's assessment. This approach could limit the client's potential for recovery and generalization of skills. A further incorrect approach would be to neglect caregiver training, assuming the client will independently manage their cognitive deficits. Caregiver involvement is often essential for successful long-term outcomes, especially for individuals with TBI. Failing to involve caregivers in training and education can lead to a lack of support and understanding in the client's home environment, hindering progress and potentially leading to frustration for both the client and their family. The professional decision-making process for similar situations requires a thorough understanding of the OT's established plan of care, the client's current functional status and goals, and the COTA scope of practice. It involves clear communication and collaboration with the supervising OT, adherence to evidence-based practices, and a commitment to ethical principles. When faced with ambiguity or a need to deviate from the plan, the COTA must consult with the OT to ensure interventions remain appropriate and within regulatory guidelines. Question 11. Strategic planning requires a certified occupational therapy assistant, COTA, working with a pediatric client diagnosed with cerebral palsy and a sensory processing disorder to address challenges in gross motor skills and social participation. The child's parent expresses significant discomfort with the current sensory integration techniques being used, stating they appear too overwhelming for the child, and requests a shift to activities solely focused on fine motor skills. The COTA believes the sensory integration techniques are crucial for the child's progress in gross motor development and social engagement, as supported by the child's recent improvements. What is the most ethically and professionally appropriate course of action for the COTA? Option A. Avoid direct confrontation with the parent by continuing the current plan without addressing their expressed concerns, hoping they will eventually understand the benefits. Option B. Schedule a meeting with the parent to collaboratively discuss their concerns, explain the rationale behind the sensory integration techniques and their impact on gross motor and social participation goals, and explore potential modifications or alternative strategies that address their concerns while still meeting the child's therapeutic needs. Option C. Immediately discontinue the sensory integration techniques and focus exclusively on fine motor activities, as requested by the parent to ensure parental satisfaction and avoid conflict. Option D. Inform the parent that the current intervention plan is evidence-based and non-negotiable, and that they must adhere to it for the child's benefit. The correct answer is B. Schedule a meeting with the parent to collaboratively discuss their concerns, explain the rationale behind the sensory integration techniques and their impact on gross motor and social participation goals, and explore potential modifications or alternative strategies that address their concerns while still meeting the child's therapeutic needs. Explanation. This scenario presents a professional challenge due to the inherent conflict between a parent's expressed wishes and the COTA professional judgment regarding the child's best interests and the established treatment plan. The COTA must navigate this ethical dilemma while adhering to the regulatory framework governing occupational therapy practice, which prioritizes client well-being and evidence-based interventions. The challenge lies in balancing respect for parental autonomy with the professional responsibility to provide appropriate and effective care, particularly when a child has complex needs like cerebral palsy and sensory processing disorder. The correct approach involves open and collaborative communication with the parent, seeking to understand their concerns and educating them about the rationale behind the current intervention. This approach aligns with ethical principles of beneficence, acting in the child's best interest, and autonomy, respecting the client's and their family's right to make informed decisions. Specifically, it adheres to the Occupational Therapy Practice Framework (OTF) guidelines, which emphasize client-centered care and the importance of family participation in goal setting and intervention planning. By explaining the therapeutic benefits of the sensory integration techniques for the child's gross motor skill development and social participation, the COTA upholds professional standards and fosters trust. An incorrect approach would be to dismiss the parent's concerns outright and insist on continuing the current plan without further discussion. This fails to respect parental autonomy and can erode the therapeutic relationship, potentially leading to noncompliance and a less effective outcome for the child. Ethically, it breaches the principle of respect for persons. Another incorrect approach would be to immediately alter the intervention plan based solely on the parent's request without a thorough assessment of the impact on the child's progress and the established goals. This disregards the COTA professional expertise and the evidence supporting the current intervention, potentially compromising the child's therapeutic outcomes and violating the principle of competence. A third incorrect approach would be to avoid the conversation altogether, hoping the parent will eventually accept the plan. This is a failure of professional responsibility and communication, demonstrating a lack of engagement with the client's family and a disregard for potential ethical conflicts. A professional decision-making process in such situations should involve active listening to the parent's concerns, validating their feelings, and then clearly and empathetically explaining the therapeutic rationale. The COTA should be prepared to discuss alternative strategies or modifications if appropriate, always grounding these discussions in the child's developmental needs and the established goals. This collaborative problem-solving approach, guided by ethical principles and professional standards, ensures that the child receives the most beneficial care while respecting the family's role in the therapeutic process. Question 12. Cost-benefit analysis shows that implementing a new adaptive tool could potentially improve a client's independence in a specific daily living activity. The client has expressed a strong desire for this particular tool. What is the most appropriate course of action for the Certified Occupational Therapy Assistant, COTA, in this situation, adhering strictly to the regulatory framework for COTA? Option A. Immediately provide the adaptive tool to the client, assuming it will be beneficial based on the client's expressed desire. Option B. Inform the client that the COTA cannot make decisions about adaptive equipment and dismiss the request. Option C. Proceed with ordering the adaptive tool independently, as the client has indicated a clear need and desire for it. Option D. Consult with the supervising occupational therapist, OD, to discuss the client's request and determine the appropriateness of the adaptive tool within the established plan of care. The correct answer is D. Consult with the supervising occupational therapist, OD, to discuss the client's request and determine the appropriateness of the adaptive tool within the established plan of care. Explanation. This scenario presents a professional challenge because a certified occupational therapy assistant, COTA, must balance the client's immediate desire for a specific adaptive tool with the regulatory requirement to ensure the tool is appropriate, safe, and aligns with the established plan of care. The COTA role is to implement interventions under the supervision of an occupational therapist, OD, and this includes making informed decisions about the use of equipment. The challenge lies in advocating for the client's needs while adhering strictly to the scope of practice and the OT's directive. The correct approach involves the COTA consulting with the supervising OT regarding the client's request for the adaptive tool. This aligns with the regulatory framework for COTA, which mandates that COTA practice under the supervision of an OT and implement interventions as directed by the OT. The OT is responsible for the overall assessment, treatment planning, and determination of appropriate interventions and equipment. By consulting the OT, the COTA ensures that the client's request is evaluated within the context of the established plan of care, safety considerations, and the client's overall functional goals, thereby upholding professional standards and regulatory compliance. An incorrect approach would be for the COTA to unilaterally provide the adaptive tool to the client without consulting the supervising OT. This violates the COTA scope of practice, which requires supervision for assessment and treatment planning decisions. It also bypasses the OT's responsibility to ensure the appropriateness and safety of interventions and equipment, potentially leading to ineffective or even harmful outcomes for the client. Another incorrect approach would be to dismiss the client's request outright without any discussion or consideration. While the COTA cannot independently authorize new equipment, ignoring a client's expressed desire for a tool can negatively impact therapeutic rapport and client engagement, and it misses an opportunity to collaborate with the OT on potential solutions. A third incorrect approach would be to proceed with ordering the adaptive tool based solely on the client's request, assuming it will be beneficial. This demonstrates a lack of understanding of the COTA supervisory relationship with the OT and the importance of the OT's role in determining the necessity and suitability of adaptive equipment. This action could lead to the use of an inappropriate or unnecessary device, wasting resources, and potentially hindering the client's progress. The professional decision-making process for similar situations involves a clear understanding of the COTA scope of practice and the supervisory relationship with the OT. When a client requests a specific intervention or piece of equipment, the COTA should first assess if this falls within their independent practice or requires OT consultation. If consultation is needed, the COTA should gather relevant information about the client's request and present it to the OT for a collaborative decision. This ensures that all interventions are client-centered, evidence-based, safe, and compliant with regulatory requirements. Question 13. Benchmark analysis indicates that a COTA is working with an elderly client who has demonstrated increasing difficulty with bathing and dressing independently, leading to increased reliance on their spouse. The client expresses frustration with their limitations, and the spouse reports feeling overwhelmed by the increased care demands. The COTA has observed that the client exhibits mild cognitive impairment and some upper extremity weakness. What is the most appropriate approach for the COTA to take in addressing these ADL challenges? Option A. Advise the spouse to take over all aspects of bathing and dressing to ensure safety and efficiency, without exploring alternative interventions or client participation. Option B. Focus solely on improving the client's upper extremity strength through repetitive exercises during ADL tasks, without considering cognitive factors or caregiver support. Option C. Immediately recommend a list of advanced adaptive equipment for bathing and dressing to the spouse, assuming the client will be able to learn and utilize them with minimal instruction. Option D. Conduct a comprehensive assessment of the client's current bathing and dressing abilities. Identify specific barriers, e.g., cognitive sequencing, motor control, explore adaptive equipment and techniques that address these barriers, and provide training to both the client and spouse on their use and on energy conservation strategies for the spouse. Correct answer is D. Conduct a comprehensive assessment of the client's current bathing and dressing abilities. Identify specific barriers, e.g., cognitive sequencing, motor control, explore adaptive equipment and techniques that address these barriers, and provide training to both the client and spouse on their use and on energy conservation strategies for the spouse. Explanation. This scenario presents a common challenge for COTA, balancing client independence with safety and caregiver burden when addressing ADLs. The professional difficulty lies in accurately assessing the client's current abilities, identifying underlying factors contributing to difficulties, and developing an intervention plan that is both effective and respects the client's autonomy and the caregiver's capacity. It requires a nuanced understanding of the client's environment, social support, and personal goals, all within the scope of COTA practice as defined by U.S. regulations and IATA guidelines. The correct approach prioritizes a comprehensive, client-centered assessment that goes beyond simply observing task performance. It involves understanding the client's underlying physical, cognitive, and psychosocial factors impacting their ability to perform ADLs. This aligns with the COTA role in contributing to the occupational therapy process by gathering data and implementing interventions under the supervision of an occupational therapist. The focus on adaptive equipment and techniques, energy conservation, and caregiver training directly addresses the identified ADL deficits and promotes functional independence and safety, consistent with best practices in occupational therapy. Regulatory frameworks emphasize the importance of evidence-based practice and client-centered care, which this approach embodies. An incorrect approach that focuses solely on immediate task completion, without understanding the root cause of the difficulty, fails to address the underlying issues, and may lead to superficial improvements or increased caregiver reliance. This neglects the COTA responsibility to contribute to a holistic understanding of the client's occupational performance. Another incorrect approach that overlies on adaptive equipment without considering the client's cognitive ability to learn and use it, or their willingness to incorporate it into their routine, is also problematic. This can lead to frustration and non-adherence. Furthermore, an approach that neglects caregiver training, assuming they can independently manage the client's needs, can lead to caregiver burnout and compromised client care, violating ethical considerations of supporting the entire care unit. The professional decision-making process for similar situations involves a systematic evaluation. First, gathering comprehensive assessment data, including client reports, caregiver input, and direct observation. Second, analyzing this data to identify contributing factors to ADL deficits. Third, collaborating with the supervising occupational therapist to develop an intervention plan that is client-centered, evidence-based, and addresses safety, independence, and caregiver needs. Finally, implementing the plan, monitoring progress, and making adjustments as necessary, always within the COTA scope of practice and ethical guidelines. Question 14. The monitoring system demonstrates a client's increasing social withdrawal and decreased engagement in previously enjoyed activities. As a COTA, which of the following approaches best addresses this observed psychosocial dysfunction while adhering to regulatory and ethical standards? Option A. Focus solely on physical exercises, assuming that improved physical health will automatically resolve the psychosocial issues. Option B. Initiate a structured social skills training program focusing on communication and interaction, incorporating stress management techniques, and utilizing the therapeutic use of self to build rapport and explore the client's feelings about their withdrawal. Option C. Advise the client to simply try harder to engage in their usual activities and suggest they might be experiencing a temporary dip in mood. Option D. Implement a generic group activity focused on relaxation without assessing the client's specific stressors or preferences. The correct answer is B. Initiate a structured social skills training program focusing on communication and interaction, incorporating stress management techniques, and utilizing the therapeutic use of self to build rapport and explore the client's feelings about their withdrawal. Explanation. The monitoring system demonstrates a client's increasing social withdrawal and decreased engagement in previously enjoyed activities, indicative of potential psychosocial dysfunction. This scenario is professionally challenging because it requires the COTA to interpret subtle behavioral changes, consider the client's overall well-being, and select an intervention that aligns with ethical practice and regulatory guidelines for occupational therapy. The COTA must balance the client's autonomy with the need for appropriate support, ensuring interventions are client-centered and evidence-based. Correct approach involves a comprehensive assessment of the client's psychosocial status, including their current stressors, coping mechanisms, and social support systems. This assessment should inform the development of a client-centered intervention plan that addresses the observed withdrawal and engagement issues. Interventions such as social skills training, stress management techniques, and potentially group therapy, tailored to the client's specific needs and preferences, are appropriate. The therapeutic use of self is paramount, building rapport and trust to facilitate open communication and collaboration. The regulatory framework for COTA emphasizes providing services that promote health and well-being, and this approach directly addresses the client's psychosocial needs within the scope of occupational therapy practice. Ethical guidelines further mandate that COTA act in the best interest of their clients, advocating for services that support their occupational performance and quality of life. An incorrect approach would be to dismiss the observed changes as a temporary mood fluctuation without further investigation. This fails to adhere to the COTA responsibility to identify and address potential health concerns, potentially delaying necessary support and violating ethical obligations to provide competent care. Another incorrect approach would be to implement a standardized, one-size-fits-all intervention without a thorough assessment. This disregards the client's unique needs and preferences, potentially leading to ineffective or even detrimental outcomes, and contravenes the principle of client-centered care mandated by regulatory bodies. Implementing interventions solely based on the COTA personal preferences, rather than on assessment data and evidence-based practice, also represents a significant ethical and professional failure, as it prioritizes the therapist's judgment over the client's needs and the established standards of practice. The professional decision-making process for similar situations involves a systematic approach. 1. Observation and data collection. Carefully observe and document client behaviors and functional changes. 2. Assessment. Conduct a thorough assessment to understand the underlying causes of the observed dysfunction, considering psychosocial factors, environmental influences, and client history. 3. Intervention planning. Collaborate with the client and the interdisciplinary team to develop a client-centered, evidence-based intervention plan. 4. Implementation and monitoring. deliver interventions, continuously monitor their effectiveness, and make adjustments as needed. 5. Documentation. Maintain accurate and timely documentation of all assessments, interventions, and client progress. This process ensures that interventions are appropriate, ethical, and aligned with regulatory requirements. Question 15. Risk assessment procedures indicate that a client with a recent distal radius fracture is eager to resume household chores, including washing dishes and light vacuuming, despite experiencing moderate pain and limited wrist range of motion. The COTA has observed the client attempting to grip cleaning supplies with excessive force and demonstrating compensatory movements during simulated tasks. What is the most appropriate initial approach for the COTA to take? Option A. Focus solely on passive modalities such as heat or ice to manage the client's pain and instruct them to rest their affected wrist as much as possible. Option B. Allow the client to resume all household chores as tolerated, encouraging them to listen to their body and stop if pain becomes severe, to promote independence and motivation. Option C. Advise the client to refrain from all household activities until their cast is removed and their range of motion has significantly improved, to prevent any potential re-injury or complications. Option D. Collaborate with the client to develop a modified approach to household tasks, incorporating joint protection principles, pain management strategies, and the use of adaptive equipment, while educating them on the rationale for these modifications and the importance of gradual progression. The correct answer is D. Collaborate with the client to develop a modified approach to household tasks, incorporating joint protection principles, pain management strategies, and the use of adaptive equipment, while educating them on the rationale for these modifications and the importance of gradual progression. Explanation. Scenario analysis. This scenario presents a common challenge for COTA, balancing a client's immediate desire for independence with the need for safe and effective participation in daily activities, particularly when dealing with a new musculoskeletal injury. The client's eagerness to resume household chores without considering the limitations imposed by a recent fracture and the potential for re-injury or delayed healing requires careful management. The COTA must navigate the client's motivation while adhering to evidence-based practice and the principles of joint protection to prevent further harm and promote optimal recovery. Correct approach analysis. The correct approach involves a comprehensive assessment of the client's current functional status, pain levels, and range of motion, followed by the development of a collaborative treatment plan. This plan should incorporate education on joint protection principles, pain management strategies, and the gradual introduction of adaptive equipment and modified techniques for household tasks. This approach is justified by the COTA ethical responsibility to provide skilled care that prioritizes client safety and promotes functional independence within the bounds of their recovery. Adherence to established occupational therapy practice guidelines for musculoskeletal conditions, which emphasize a client-centered, evidence-based approach, is paramount. This includes ensuring the client understands their condition, the rationale behind interventions, and their role in the recovery process. Incorrect approaches analysis. One incorrect approach would be to immediately allow the client to resume all household tasks without a thorough assessment or modification. This fails to uphold the COTA duty of care by disregarding the potential for exacerbating the fracture, increasing pain, or delaying healing. It neglects the fundamental principles of joint protection and could lead to adverse outcomes, violating ethical obligations to prevent harm. Another incorrect approach would be to restrict the client from all household activities indefinitely, without exploring adaptive strategies or modifications. This approach, while seemingly cautious, can be overly restrictive and may negatively impact the client's morale and sense of self-efficacy, hindering their engagement in therapy and overall recovery. It fails to explore the full scope of occupational therapy interventions, such as adaptive equipment and task modification, which are designed to facilitate participation safely. A third incorrect approach would be to focus solely on passive modalities for pain relief, without addressing the client's functional goals and the underlying biomechanical issues contributing to their limitations. While pain management is important, it should be integrated with active interventions that promote strength, range of motion, and functional return, as guided by the principles of occupational therapy. This narrow focus neglects the holistic nature of occupational therapy and the client's desire to resume meaningful occupations. Professional reasoning. Professionals should approach this situation by first conducting a thorough occupational therapy evaluation, including a client interview to understand their goals and concerns, observation of functional tasks, and assessment of pain, range of motion, and strength. Based on these findings, the COTA should collaborate with the client to establish realistic, achievable goals. Interventions should then be tailored to address these goals, incorporating education on joint protection, pain management techniques, and the use of adaptive equipment and energy conservation strategies. Regular reassessment and modification of the treatment plan based on the client's progress and feedback are essential. This systematic, client-centered, and evidence-based process ensures that interventions are safe, effective, and aligned with the client's overall recovery and well-being. Question 16. Market research demonstrates that occupational therapy interventions for wound care are increasingly focused on patient outcomes. A certified occupational therapy assistant, COTA, is providing care for a patient with a stage Roman II pressure injury. The COTA observes that the edema around the wound has increased since the previous day, and the current dressing appears to be intact and appropriately applied. The COTA is unsure if this increased edema is a normal part of the healing process or a sign of a complication. What is the most appropriate course of action for the COTA? Option A. Immediately remove the current dressing and apply a different type of dressing that is known to help with edema control without consulting the occupational therapist. Option B. Document the increased edema as a normal finding in the wound healing process and continue with the current dressing and treatment plan. Option C. Perform a comprehensive wound assessment, including evaluation of the edema, surrounding skin, and the current dressing, and then report all findings and concerns to the supervising occupational therapist for further evaluation and intervention planning. Option D. Focus on implementing scar management techniques, such as massage, to address the increased edema and promote healing. The correct answer is C. Perform a comprehensive wound assessment, including evaluation of the edema, surrounding skin, and the current dressing, and then report all findings and concerns to the supervising occupational therapist for further evaluation and intervention planning. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the certified occupational therapy assistant, COTA, to differentiate between a normal physiological response to healing and a potential complication requiring intervention. Misinterpreting edema as solely a consequence of the wound dressing, rather than considering other contributing factors or the wound's healing stage, could lead to inappropriate treatment, delayed recovery, and potential patient harm. The COTA must apply their knowledge of wound healing, edema management, and infection control within the scope of their practice and under the supervision of an occupational therapist. Correct approach analysis. The correct approach involves a comprehensive wound assessment that considers the wound's healing stage, the type of wound, and the patient's overall condition. This includes evaluating the edema in relation to the wound, the dressing's appropriateness, and signs of infection. The COTA would then communicate their findings to the supervising occupational therapist, who would determine the most appropriate intervention. This aligns with the COTA role in implementing treatment plans developed by the occupational therapist and reporting observations. Regulatory frameworks for COTA emphasize working under supervision and contributing to the assessment process by gathering data and reporting findings. Ethical practice dictates prioritizing patient safety and well-being by seeking expert guidance when unsure or when a complication is suspected. Incorrect approach is analysis. One incorrect approach would be to immediately assume the edema is solely due to the dressing and unilaterally change it without a thorough assessment or consultation. This bypasses the supervisory relationship with the occupational therapist and could lead to an inappropriate dressing choice, potentially exacerbating the edema or failing to address the underlying cause. It also fails to consider other potential causes of edema, such as venous insufficiency or immobility, which are outside the scope of simple dressing adjustment. Another incorrect approach would be to ignore the edema, assuming it is a normal part of the healing process, and continue with the current dressing. This neglects the COTA responsibility to observe and report changes in the patient's condition. Edema can be a sign of infection, impaired circulation, or other complications that require prompt attention and intervention by the occupational therapist. A third incorrect approach would be to focus solely on scar management techniques without addressing the underlying edema. While scar management is important for wound healing, it is premature and ineffective if significant edema is present and unmanaged. Edema can impede the effectiveness of scar massage and other scar management strategies. Professional reasoning. When faced with a patient exhibiting new or worsening edema around a wound, the COTA should follow a systematic decision-making process. First, recall the principles of wound healing and common complications. Second, conduct a thorough assessment of the wound and surrounding tissue, noting the characteristics of the edema, location, severity, pitting, warmth, redness. Third, evaluate the current dressing for appropriateness and signs of compromise. Fourth, consider other potential contributing factors to the edema. Fifth, communicate all findings and concerns to the supervising occupational therapist, providing objective data. Finally, await further instructions and implement the revised treatment plan as directed. This process ensures patient safety, adherence to scope of practice, and effective collaboration within the healthcare team. Question 17. Operational review demonstrates that a certified occupational therapy assistant COTA is working with a client recovering from a work-related musculoskeletal disorder. The client expresses a strong desire to return to their previous job as a warehouse associate, which involves frequent lifting, bending, and prolonged standing. The COTA has completed an initial assessment and is developing a work hardening program. Which of the following approaches best aligns with regulatory requirements and best practices for facilitating a safe and successful return to work? Option A. Focus primarily on the client's subjective reports of pain reduction and allow them to dictate the pace and intensity of the work hardening program without objective functional measures. Option B. Implement a generic exercise program focusing on general strength and endurance, assuming that improved overall fitness will prepare the client for their job duties. Option C. Expedite the return-to-work process by having the client attempt some of their job tasks immediately, even if they have not fully met objective functional benchmarks, to demonstrate their willingness to return. Option D. Design a work hardening program that progressively simulates the essential physical demands of the warehouse associate role, incorporating ergonomic principles and regular objective functional assessments, while also considering potential ADA reasonable accommodations in consultation with the client and physician. Correct answer is D. Design a work hardening program that progressively simulates the essential physical demands of the warehouse associate role, incorporating ergonomic principles and regular objective functional assessments, while also considering potential ADA reasonable accommodations in consultation with the client and physician. Explanation. This scenario is professionally challenging because it requires the certified occupational therapy assistant, COTA, to balance the immediate needs of a client with the long-term goal of successful return to work, all while adhering to specific regulatory requirements and ethical considerations within the U.S. healthcare framework. The COTA must navigate the complexities of work hardening, job analysis, and ADA compliance to ensure the client's safety, efficacy of treatment, and legal rights are upheld. The correct approach involves a systematic and client-centered process that prioritizes safety and functional improvement within the context of the client's specific job demands. This approach aligns with the Occupational Therapy Practice Framework, OTF, which emphasizes client participation and occupation-based interventions. Specifically, it adheres to the principles of work hardening by progressively increasing physical demands in a simulated work environment, informed by a thorough job analysis. Furthermore, it ensures compliance with the Americans with Disabilities Act (ADA) by considering reasonable accommodations and the client's ability to perform essential job functions. This approach is ethically sound as it promotes client autonomy, beneficence, and non-maleficence by ensuring interventions are appropriate and safe. An incorrect approach that focuses solely on the client's subjective report of pain, without objective functional assessment, fails to meet the standards of evidence-based practice and may lead to premature return to work or inadequate preparation, increasing the risk of re-injury. This neglects the regulatory expectation for objective data to guide treatment and return-to-work decisions. Another incorrect approach that bypasses a formal job analysis and implements generic exercises without considering the specific demands of the client's occupation is ethically problematic and potentially non-compliant with ADA requirements. The ADA mandates consideration of essential job functions, which cannot be determined without a proper job analysis. This approach also risks providing ineffective interventions that do not adequately prepare the client for their actual work tasks. An incorrect approach that prioritizes expediting the return-to-work process over ensuring the client's readiness and safety is a significant ethical and regulatory failure. This could lead to a compromised return-to-work outcome, potential re-injury, and legal ramifications for both the client and the healthcare provider. It violates the principle of beneficence by not acting in the client's best interest. Professional decision-making in such situations requires a systematic process. First, thoroughly understand the client's condition and goals. Second, conduct a comprehensive job analysis to identify essential functions and physical demands. Third, develop a work hardening program that progressively simulates these demands, incorporating ergonomic principles. Fourth, continuously assess the client's progress objectively. Fifth, collaborate with the client, employer, and physician to determine readiness for return to work, considering COTA accommodations if necessary. And finally, document all interventions and assessments meticulously. Question 18. The monitoring system demonstrates that Mr. Henderson, a 78-year-old gentleman with a history of falls and mild cognitive impairment, has repeatedly attempted to access his upstairs laundry room without using the installed stairlift. He has also expressed a strong desire to remove the grab bars his family recently installed in his bathroom, stating they are ugly and he doesn't need them. As a COTA, what is the most appropriate course of action to ensure Mr. Henderson's safety and promote his independence in his home environment? Option A. Recommend the installation of a completely new, more aesthetically pleasing stairlift and suggest alternative storage solutions for laundry to eliminate the need for upstairs access, without further assessment of his current functional abilities or the safety of the existing grab bars. Option B. Immediately remove the grab bars as requested by Mr. Henderson to improve the aesthetic appeal of his bathroom and focus on reinforcing the use of the stairlift through repeated verbal instructions. Option C. Conduct a comprehensive home safety assessment, focusing on fall prevention strategies and functional limitations, and collaborate with Mr. Henderson to identify modifications that balance his aesthetic preferences with essential safety features, while educating him on the importance of the existing grab bars and the safe use of the stairlift. Option D. Advise Mr. Henderson's family to enforce stricter supervision and limit his access to the upstairs area and bathroom until he agrees to use the stairlift and retain the grab bars, prioritizing immediate safety over his expressed preferences. Correct answer is C. Conduct a comprehensive home safety assessment, focusing on fall prevention strategies and functional limitations, and collaborate with Mr. Henderson to identify modifications that balance his aesthetic preferences with essential safety features, while educating him on the importance of the existing grab bars and the safe use of the stairlift. Explanation. This scenario presents a professional challenge because it requires the Certified Occupational Therapy Assistant, COTA, to balance the client's expressed preferences with objective safety recommendations, all while adhering to established accessibility guidelines and universal design principles within the U.S. regulatory framework. The COTA must advocate for the client's independence and quality of life, while ensuring their home environment minimizes risks and promotes safety. Careful judgment is required to avoid imposing solutions that are overly restrictive or fail to address the underlying functional limitations. The correct approach involves a comprehensive home safety assessment that identifies specific hazards and functional limitations. Based on this assessment, the COTA recommends modifications and adaptations that are evidence-based, client-centered, and align with U.S. accessibility standards, e.g., COTA guidelines where applicable to residential settings, though direct application varies, and universal design principles. This approach prioritizes the client's safety and independence by providing practical, achievable solutions that enhance accessibility and reduce fall risk, directly addressing the identified needs. The justification lies in the COTA ethical responsibility to promote client well-being and safety, as outlined by the American Occupational Therapy Association, AOTA, Code of Ethics, and their professional responsibility to apply knowledge of environmental adaptations and accessibility. An incorrect approach would be to solely implement the client's requested modifications without a thorough safety assessment. This fails to address potential underlying risks that the client may not recognize or articulate, potentially leading to continued safety hazards or the implementation of ineffective solutions. This approach violates the ethical principle of beneficence by not actively promoting the client's safety and well-being. Another incorrect approach would be to recommend modifications that are excessively costly or complex without exploring more feasible alternatives. This disregards the client's financial resources and potential for successful implementation, potentially leading to frustration and abandonment of the recommendations. It also fails to adhere to the principle of client-centered care, which involves collaborating with the client to find solutions that are practical and sustainable for them. A third incorrect approach would be to focus only on aesthetic preferences without adequately addressing functional needs and safety concerns. While client preferences are important, the primary role of the COTA in home modifications is to enhance safety and function. Ignoring these aspects can lead to a home that is visually appealing but still poses significant risks to the client's health and independence. This neglects the core tenets of occupational therapy practice, which are rooted in enabling participation in meaningful occupations through environmental adaptations. The professional decision-making process for similar situations should involve a systematic approach. 1. Conduct a thorough client-centered assessment of the home environment, identifying functional limitations and safety hazards. 2. Collaborate with the client to understand their goals, preferences, and resources. 3. Research and recommend evidence-based modifications and adaptations that align with accessibility guidelines and universal design principles, prioritizing safety and function. 4. Educate the client and caregivers on the rationale behind recommendations and proper use of adaptations. 5. Document the assessment, recommendations, and client's response. Question 19. The assessment process reveals that an 82-year-old client with a recent diagnosis of moderate Alzheimer's disease is experiencing increased difficulty with activities of daily living including dressing and bathing, and has had 2 falls in the past month within their home. The client lives alone, and their adult child visits weekly, expressing concerns about their parents' safety and memory lapses. The client expresses frustration with their limitations, but also resistance to perceived babying. Which of the following approaches best addresses the client's complex needs while adhering to COTA responsibilities in the United States? Option A. Immediately recommend the client move to an assisted living facility due to the fall risk and cognitive decline, and inform the adult child that the COTA cannot address the client's resistance to care. Option B. Focus solely on fall prevention by recommending the client remain seated as much as possible and avoid complex tasks, and document the client's resistance without further intervention. Option C. Advise the adult child to take over all ADLs and medication management for the client, and suggest the client stop engaging in any social activities to minimize potential risks. Option D. Implement a structured ADL retraining program focusing on simplified steps and visual cues. Conduct a home safety evaluation with environmental modifications, and provide caregiver training on safe transfer techniques and medication reminders, while also initiating a conversation with the client about their concerns and preferences for participation in the intervention plan. The correct answer is D. Implement a structured ADL retraining program focusing on simplified steps and visual cues, conduct a home safety evaluation with environmental modifications, and provide caregiver training on safe transfer techniques and medication reminders, while also initiating a conversation with the client about their concerns and preferences for participation in the intervention plan. Explanation: this scenario is professionally challenging because it requires the Certified Occupational Therapy Assistant, COTA, to balance the immediate safety needs of an elderly client with their right to autonomy and participation in decision-making, all within the scope of practice and ethical guidelines for COTA in the United States. The COTA must consider the client's cognitive status, the potential risks associated with their condition, and the legal and ethical obligations to report suspected abuse or neglect. The correct approach involves a comprehensive assessment that includes direct observation, client and caregiver interviews, and environmental evaluation, followed by the development of an individualized intervention plan. This plan should prioritize safety while promoting independence and dignity. Specifically, the COTA should focus on ADL retraining, cognitive rehabilitation strategies, home safety modifications, and caregiver education, all tailored to the client's specific needs and abilities. This aligns with the COTA Occupational Therapy Practice Framework, Domain and Process, which emphasizes client-centered care, occupation-based interventions, and collaboration with clients and their support systems. Furthermore, the COTA has a legal and ethical responsibility to report any suspected elder abuse or neglect to the appropriate authorities, as mandated by state laws and professional ethical codes. An incorrect approach would be to solely focus on restricting the client's activities to prevent falls without exploring underlying causes or involving the client in the decision-making process. This disregards the client's autonomy and may lead to decreased engagement and quality of life. Another incorrect approach would be to ignore potential signs of elder abuse or neglect, which is a direct violation of ethical obligations and potentially state laws requiring reporting. Failing to involve caregivers in the intervention plan is also problematic, as their support is crucial for successful outcomes, particularly in areas like medication management and environmental safety. Professional decision-making in such situations requires a systematic approach. 1. Gather comprehensive information through assessment. 2. Analyze the information to identify the client's strengths, needs, and risks. 3. Collaborate with the client and their support system to establish goals. 4. Develop and implement an evidence-based intervention plan that addresses safety, function, and well-being. 5. Continuously monitor progress and modify the plan as needed. 6. Adhere to all legal and ethical reporting requirements. Question 20. Compliance review shows that a certified occupational therapy assistant, COTA, is working with a client who has recently experienced a stroke and has significant difficulty with dressing independently. The client expresses a strong preference for practicing dressing with adaptive clothing items that are easy to put on, even though their current functional level suggests that establishing/restoring the underlying motor skills for dressing with typical clothing would be more beneficial for long-term independence. The COTA needs to develop an intervention plan. Which of the following approaches best reflects client-centered practice and effective intervention planning within the regulatory framework for COTA? Option A. Collaborate with the client and family to explore the rationale behind their preference. Educate them on how an establish/restore approach can improve their ability to dress with typical clothing, and jointly develop SMART goals that address the underlying functional deficits while acknowledging their desire for independence. Option B. Focus the intervention plan on modifying the environment to make dressing easier, without addressing the client's underlying motor skills, as this directly addresses their stated difficulty. Option C. Proceed with interventions focused solely on the client's stated preference for adaptive clothing, without further discussion or exploration of alternative approaches, to respect their autonomy. Option D. Immediately implement interventions using adaptive clothing items as requested by the client to ensure their immediate comfort and satisfaction, as client preference is paramount. The correct answer is A. Collaborate with the client and family to explore the rationale behind their preference. Educate them on how an establish/restore approach can improve their ability to dress with typical clothing, and jointly develop SMART goals that address the underlying functional deficits while acknowledging their desire for independence. Explanation. This scenario presents a professional challenge because the COTA must balance the client's stated preferences with the therapist's professional judgment regarding the most effective intervention approach, all while adhering to the principles of client-centered practice and regulatory requirements for goal setting and intervention planning. The COTA must ensure that the chosen intervention is not only acceptable to the client, but also evidence-based and aligned with the client's occupational goals and the established plan of care. The correct approach involves a collaborative discussion with the client and their family to explore the underlying reasons for the client's preference, and to educate them on the benefits of an approach that directly addresses the identified functional deficit. This aligns with the regulatory framework's emphasis on client-centered practice, which mandates that interventions be tailored to the individual's needs, values, and preferences. Specifically, the COTA must engage in shared decision-making, ensuring the client understands the rationale behind different intervention strategies. The SMART goal-setting framework requires goals to be specific, measurable, achievable, relevant, and time-bound. By discussing the client's preferences and explaining how an establish/restore approach can lead to greater independence and participation in desired occupations, the COTA facilitates the development of relevant and achievable goals. This collaborative process ensures the intervention plan is client-centered and ethically sound, promoting the client's autonomy and engagement. An incorrect approach would be to immediately dismiss the client's preference without further exploration. This fails to uphold the principle of client-centered practice, which requires active client participation in the intervention planning process. Ethically, it can be perceived as paternalistic and may lead to decreased client motivation and adherence to the intervention plan. Another incorrect approach would be to solely focus on the client's stated preference without considering the established plan of care or the therapist's professional judgment regarding the most effective intervention strategy. This disregards the COTA responsibility to provide skilled interventions that are evidence-based and designed to achieve functional outcomes. It also fails to adhere to the principles of activity analysis and adaptation, which are crucial for selecting appropriate interventions. A third incorrect approach would be to proceed with an intervention that does not directly address the client's underlying functional limitations, even if it aligns with their stated preference. This would not be an effective use of therapeutic time and resources, and would likely not lead to the achievement of meaningful occupational goals. It also fails to demonstrate the therapeutic use of occupations and activities in a way that promotes functional improvement. The professional decision-making process in such situations involves a systematic approach. First, actively listen to and acknowledge the client's preferences and concerns. Second, conduct a thorough activity analysis to understand the demands of the desired occupation and identify the specific deficits hindering participation. Third, collaborate with the client and family to educate them on various intervention approaches and their potential benefits, linking them to the client's goals. Fourth, jointly develop SMART goals that are relevant, achievable, and reflect the client's priorities and the therapist's professional recommendations. Finally, select and implement intervention strategies that are evidence-based, client-centered, and aligned with the established plan of care.